In October, the World Health Organization setting a goal for countries to fully vaccinate at least 70% of their populations by mid-2022. But listen to this, fewer than 50 countries have already reached that threshold and many are still falling behind. Vaccination rates continue to lag in low-income countries where only 11% have received at least one dose. Joining us this morning is Dr. Tsion Firew. She is an emergency medicine physician and assistant professor at Columbia University Medical Center in New York. And Dr. Firew, thanks for being with us. We've seen COVID's impact on black and brown communities here in the U.S., but Burundi, the Democratic Republic of Congo, Haiti, among the least vaccinated countries in the world, Burundi and the DRC, less than 1% of the population there have received one dose.
Yes, that is repulsive. And as we've seen in many of the African countries and in some South Asian countries, that the numbers are very, very low. The uptakes are very, very low. And this is mostly because of vaccine nationalism and capitalism, where the doses are going to the rich nations and there's not been an equitable distribution of the vaccines. And there's been a lot of blame that, some of this poor countries, if they're given the vaccines, that they're not going to be able to administer them on time. But that's absolutely false. Many countries, especially in African countries, have the expertise when it comes to infectious diseases like measles, polio, and so many other things where they would have to vaccinate, where vaccine campaigns are such a common thing. Even in my home country in Ethiopia, where vaccines for measles and other vaccines have been distributed successfully, but when it comes to COVID vaccine, especially from the very start, there's not been an equal distribution of the vaccines available for much parts of the world in Africa. And it's unfortunate we continue to see this. And just like you said, by December 2021, the World Health Organization is hoping to have at least 40% of the population in Africa vaccinated. But only few countries like Seychelles, Rwanda, Mauritius, the countries that are very easy logistic access, have been able to vaccinate most of the population of their country, but not so many countries.
Dr. Firew, if we have learned anything in this pandemic, it is that viruses know no borders. They don't sit in either first class or coach on a plane. They don't come in by boat. They come in by boat, plane, train, however they can get into this country. Omicron, we now believe, may have originated in South Africa and Southern Africa, but we also know it came from Europe. That being the case, why isn't the rest of the world more aggressively doing more to make sure that places like Africa are fully vaccinated? Because we've already seen what happens when it's not.
Absolutely. And I would have to challenge you about, because we're still investigating when it came from. I know a lot of the numbers initially with Omicron, I think the South African countries, they were the first countries to isolate it. It doesn't mean it came from there. And we've seen it that it was actually detected and was spreading in some parts of Europe. So I'm not convinced yet it originated from Southern African countries, and I'll challenge you about that, because I think really we were so reactive to punish and really move towards isolating these countries when they should have been rewarded. And to answer your question at this point, yes, we haven't learned. 2 years into this pandemic, there is this attitude of me or us versus them. People have not learned. Unfortunately, our politicians, doing this to their citizens, to their own nation, mostly they're prioritizing that and really forgetting about the rest of the world and not living by their word, especially when a lot of the leaders have said that not everybody is safe until everyone is safe. And this notion that we keep on boosting and vaccinating and building up walls to protect only our citizens does not work. Pandemic, by definition, means it's a problem of many nations. It's not an endemic just affecting one country, but it's a global problem. So we need a global solution for this. When it comes to the convention at the UN back in September, the US had promised to deliver up to 1 billion doses for COVAX, which is a coalition run by the WHO and by CEPI and Gavi, to deliver vaccine to the lower and middle income countries of the world. And many countries have promised to deliver these vaccines, but again, it just ends up being in words and in documents, but really not reaching to the arms of the people that need it. So really, people need to recognize that we need a global solution. And as long as COVID continues to be a problem in one country, in one place, it's going to be a problem for all. So we're all going to be a threat until we eliminate it and we control it. And we need to have this notion that we need to work together. And the WHO has made a point that we need to work together and find a solution and not work in silos.
Yeah. We are all in this together. Dr. Tsion Firew, by the way, she finished up her shift last night at midnight. She is an emergency medicine physician and assistant professor at Columbia University Medical Center. Dr. Firew, as always, thanks for being with us this morning.